Hi everyone, so I introduce myself. I'm Ross Williams, or Ross D. Williams if you want to look me up on Google Scholar. So I'm a PhD student here at the Department of Medical Informatics at Erasmus MC, and I've been working, during my PhD I was working on Eden Work Package 3, which is personalized medicine. Mostly I've been focusing on patient level prediction modeling and prediction research. As well as that, I also have a role within Work Package 3, so I'm the co-lead of Work Package 3, and I'm also recently the co-lead of the development pillar within the Darwin project. So my work on prediction, so the idea here is that we want to come up with a personalized risk score for patients, and then based upon that you'll give some kind of intervention for patients. You'll say, okay, so I want to give my patient a certain treatment, but we know that this treatment has a high risk of some outcome. What if my patient is already at high risk of that? Am I then going to still give them this treatment? Am I going to choose some other option? So these are all sort of like important questions, and we know that clinicians and healthcare providers are basically faced every day with risk estimation, and if we can help them out with that, then it will be able to sort of, one, take a little bit of load off of them, and two, just give them an extra tool in their arsenal to help treat patients. We see a lot within, say, cancer research and within cancer treatment that patients now are having really highly specialized treatments and really highly personalized treatments, and the idea is that some of these risk prediction models we'll be able to do this for other areas. And so an example from my own research, so I published a paper, I think this year, might have been last year, but we developed a new method called iterative pairwise external validation. And what this did was it allowed us to use multiple databases to develop models and to give context to the performance of these models when externally validated in other databases. But on the clinical side, in that same paper, we took an example from the diabetes treatment guidelines, which says that when a patient is initially treated for diabetes, they receive sort of lifestyle intervention advice, and they also receive metformin. However, if this doesn't bring their HbA1c level, which is some sort of biomarker for diabetes, under control within a certain amount of time, they will be started on a second-line medication. There's currently, or the last I checked, there are about 6 or 7 different of these medications for this second line, but these all have different risk profiles associated with them. So some of them are diuretics, and this can have sort of beneficial impacts for patients with heart failure. Some of them actually cause water retention, so if you're at risk of heart failure, then you really don't want that to happen. And within the guidelines, there is a divergence in treatment for patients who are at high risk of heart failure and patients who are at high risk of kidney failure. Patients at high risk of heart failure are recommended one medication, patients at high risk of kidney failure are recommended another medication. However, within the guidelines, there was no evidence-based model, or there was no advice on how you know if a patient is at high risk. And this then relies on either clinician intuition or experience, and we know clinicians are good at what they do. However, it's really nice to have a systematic way to calculate these risks. And that's what we developed in this process. And where this fits in with Eden is, one, you couldn't do this without a federated network of databases. You need to have this in order to generate your evidence, in order to have the connection to the research who can help you with this project. This was, again, a collaborative project within the sort of Odyssey ecosystem. So the question that we have, once we have this network of databases, is what do we need to do in order to get these models into practice? And this is where the second E within Eden comes in, and that is evidence. How do we provide evidence for these models, and how do we use that evidence to then either fix the models, identify problems, fix the problems, identify areas where we can have a real impact, and more generally just how do we generate this evidence and what do we need to know before we can start to use them? And that's where I really see sort of my interest lying, and I see sort of a lot of the work from Work Package 3 moving towards in the future, and I think particularly thinking about the sustainability of the project after the end of Eden. We really need to start thinking about how are we going to continue to generate this evidence, and what is the evidence that we need, and not just to say, okay, we have a nice performance prediction model so we can publish a nice article on it, but how can we generate the evidence that makes us comfortable to say, we can really use this model now to change this patient's treatment today, and we are sure that it will have a beneficial impact. And that's where I really hope that we can start sort of move towards over the next few years, and sort of slightly out of where we have been, which is this idea of, some the fantastic work that's been done within Eden on the developing of these models and developing of these methods, and really start to make an impact.